All right, today we are talking about sudden illnesses for lesson 5. Okay, so first one we're going to talk about shock, but first up, your first secret word that you need to write down on your worksheet is dog. Okay, so shock. Any serious illness or injury can lead to shock, a life-threatening condition. Shock occurs when the heart and blood vessels are not able to supply all parts of the body with enough blood. As a result, organs and body systems begin to fail. Whenever you are caring for a person who has become suddenly ill or seriously injured, you need to watch for these signs and symptoms. Okay, relentlessness or irritability, changes in level of consciousness, pale, ashen, or grayish, cool, moist skin, rapid breathing and heartbeat, excessive thirst, nausea, or vomiting. Call 911. A person who is beginning to go into shock needs advanced care. So call 911 or the designated emergency number immediately if you have not already. While you're waiting for EMS personnel to arrive, make sure you have the person lie down if possible, control their bleeding if necessary, cover them with a blanket to prevent loss of body heat. Do not give them anything to drink or eat, even if the person complains of being thirsty, and reassure the person until EMS personnel arrive. Okay, that is shock. Review of heart attack. A heart attack occurs when blood flow to part of the heart muscle is blocked, causing cells to die and leading to permanent damage of the heart muscle. Seeking advanced medical care as soon as the signs and symptoms of heart attack are recognized minimizes the damage to the heart and may save a person's life. Seeking advanced medical care is important because remember we talked about how time is of the essence when it's regarding a heart attack, and we want to get them there as quickly as possible. You have already watched this heart attack video, so we're just going to go straight into the signs and symptoms. As a review, chest pain, discomfort, pressure, or squeezing that lasts longer than 3 to 5 minutes and is not relieved by resting, changing their position, taking medication, or it goes away and comes back. Discomfort or pain that spreads to one or both arms, the back, the shoulder, the neck, the jaw, or the upper part of the stomach. Dizziness, lightheadedness, trouble breathing, and noisy breathing, shortness of breath, and breathing that is faster than normal. Pale or ashen gray skin, nausea, vomiting, sweating, a feeling of anxiety or impending doom, extreme fatigue, and unresponsiveness can all be signs and symptoms. Individuals may experience heart attack signs and symptoms differently, and not everyone will have every sign and symptom. Even people who have had a heart attack before may not experience the same signs and symptoms if they have a second one. While men often have the classic signs and symptoms of a heart attack, such as chest pain that radiates down one arm, women often have more subtle signs and symptoms. In women, they could have chest pain or discomfort that will be more mild, and general signs and symptoms such as shortness of breath, vomiting, extreme fatigue, dizziness, and lightheadedness. Because these signs and symptoms are so general and nonspecific, women may experience them for hours, days, or even weeks leading up to the heart attack, but dismiss them as nothing out of the ordinary. Signs and symptoms of a heart attack may also be more subtle in people with certain medical conditions, such as diabetes. Many people who are experiencing the signs and symptoms of a heart attack wait too long to get advanced medical care. The reason that they do this could be a lack of knowledge. They may not know they're having a heart attack. They may be in denial or scared if they are having one. They have concerns about being wrong and feeling foolish if they are wrong. And some might just not have access to the health care in order to do so. So it's important to call 911 if you think someone is having a heart attack. Breathing emergencies, first aid care. All right, so if you think someone is having a heart attack, act promptly. Call 911. Be prepared to give CPR. You guys all know how to do CPR and use the AED. If someone becomes unresponsive and stops breathing, you are trained to do so. Help the person rest in a comfortable position and loosen any tight clothing. Many people find it easier to breathe when sitting. If the person takes prescribed medication for chest pain, make sure you give that to them. Reassure the person and monitor his or her condition until EMS personnel arrive. Aspirin helps prevent blood clotting and can be effective when given soon after a person experiences signs and symptoms of a heart attack. Other types of pain relief are not effective for a person who is experiencing a heart attack. Aspirin containing combination products meant to relieve multiple conditions are also not effective for a person who is experiencing a heart attack. Do not delay calling 911 or the designated emergency number to look or offer aspirin. Only offer aspirin if the person is responsive, able to chew, and swallow and is allowed to have aspirin. All right, if to verify that the person is allowed to have aspirin, make sure you ask, are you allergic? Do you have a stomach ulcer or stomach disease? Are you taking any blood thinners? Have you ever been told by healthcare providers to avoid taking aspirin? And if the person answers no to each of these, you may offer the person 2 81 milligram low-dose aspirin tablets or 1 325 milligram regular strength aspirin tablets. Make sure you have the person chew the aspirin completely. Moving on to breathing emergencies. All right, a breathing emergency occurs when a person is having trouble breathing or cannot breathe at all. Some common causes of breathing emergencies could be choking, severe allergic reaction, acute flare-up, cardiac conditions, respiratory infection, emotional distress, drug overdose, poisoning, trauma to the head, chest, lungs, or abdomen, and drowning. Some signs and symptoms. You can recognize a breathing emergency by observing the person's actions, listening to their breathing, and asking how he or she feels. Some of these symptoms include no breathing, shortness of breath or trouble breathing, being unable to talk without stopping for a breath in between every few words, changes in breathing rate from fast to slow, the depth, so it could be shallow or a deep breath, or their rhythm is irregular. Gasping, wheezing, gurgling, or high-pitched noises, changes in their skin color, dizziness, chest pain, apprehension, or anxiety. It's important to recognize when someone is experiencing a breathing emergency and take prompt action, because a breathing emergency can lead to a cardiac arrest if not properly treated. If a person is having trouble breathing, determine whether to summon EMS personnel. Help them rest in a comfortable position. Sitting and leaning forward slightly often helps make breathing easier. If the person is finding it difficult to talk, phrase questions so that they can be answered by nodding or shaking their head. If you know that the person is having difficulty breathing as a result of a medical condition such as asthma or severe allergic reaction, offer to help the person with their medications such as inhaler or their EpiPen. Continue to watch for changes in their condition and be prepared to give CPR and use the AED if they become unresponsive and you are trained to do so. A person with asthma may take a quick relief medication to stop their asthma attack. Quick relief medications work quickly to relieve swelling, opening the airways right away. These medications are often administered through an inhaler. If a person requests your help using an inhaler, you can do the following. You can shake the inhaler, remove the mouthpiece cover. If the person uses a spacer, attach it to the mouthpiece. Give the inhaler to the person and advise the person to use it as directed by his or her healthcare provider. Be aware that more than one dose of medication may be needed to stop the asthma attack. After using the inhaler, the person's breathing should improve within 5 to 15 minutes. If the person's breathing does not improve, call 911 or the designated emergency number. If the person becomes unresponsive, make sure that the 911 or designated emergency number has been called, begin CPR immediately, and use the AED as soon as possible if you are trained to do so. All right, so epinephrine is a drug that slows or stops the effects of anaphylaxis. So, what should you do if someone is showing signs and symptoms of this? Have someone call 911 or the designated emergency number immediately. Help the person use their medication for the emergency and treatment. Make sure the person is sitting in a comfortable position. Have them lie down. And if you're alone, help the person with the medication and then call. All right. Last thing, if you're alone and there's no one to send a call, what should you do? Help the person use their medication, right? Using the epinephrine auto-injector training advice, the injection site is outside of the middle of the thigh. The tip of the auto-injector should be held at 90-degree angle to the thigh. The medication is administered by quickly and firmly pushing it into the thigh until a click is heard or felt. The auto-injector should be held in place for the recommended amount of time, 5 to 10 seconds, and depending on the device, it might differ. After the medication is administered, massage the injection site, place the used auto-injector with the needle pointing down in its carrying case or other rigid container and give it to EMS personnel when they arrive for proper disposal. If the person is still having signs and symptoms 5 to 10 minutes after administering the first dose of epinephrine and emergency responders have not arrived, the person should administer a second dose. That is the end of part 1. Make sure to watch part 2.